Welcome back to the Aberdeen Audiology YouTube channel. I'm Dr. Tom Goyne, Chief Audiology Officer at Aberdeen Audiology. We've got offices in Philadelphia suburbs, Wayne, Malvern, Westchester. We can see lots of people through telehealth as well. If you're in need of our services, please reach out to us. For this video, we're going to talk about some of the most common reasons people struggle with hearing aids. Either they don't have as much success out of the gate as they thought they were going to, or these are folks who have come to our office with devices from another provider, and they're not having as much success as they had thought. And so here's some of the reasons, the most common reasons we see in our office as to why people struggle. And I think the first one, the one that we have conversations about most often and go over most often with patients, is that you need to let your brain adapt. So most people who get hearing aids have had hearing loss for a while. There are a few people who have had hearing loss suddenly, either from a virus or an accident, something like that. But most people, the hearing loss has been brewing for some time. It may be taking a number of years to come about. And so because of that, the brain isn't adapted to hearing as well as it should. It doesn't know what to make of certain sounds. It doesn't know how to ignore certain sounds. And again, this is a wonderful example of how this isn't as easy to address as a lot of people think it is. It's not a matter of like glasses. We just pop glasses on and we see well. Hearing well with hearing aids is a little bit different. It takes a little bit of time. And one of the reasons why it takes time is your brain has to adapt a little bit. And so I think a lot of providers working with hearing aids, certainly the general public, they forget or don't realize how much adaptation takes place. Some of the most common research cited will say that of the adaptation you're going to do, 80% happens in the first 2 weeks. The other 20% can take as long as 6 months. And that is assuming you're wearing the devices regularly. And so it's really important to trust the process, wear the devices a lot, let your brain adapt. And generally, that takes care of a lot of issues there. Another thing that we see a lot, though, is that the devices are not properly configured in the first place. Of course, there are formulas and protocols that we try to follow to make sure that people are hearing as well as possible right out of the gate. But every patient's a little bit different, and sometimes some adjustments do need to be made. And then if I'm being honest, there are some providers out there working with hearing aids who probably aren't configuring the devices as well as they should be. And so we'll see patients come to our office from other providers with hearing aids that aren't benefiting them as much as they had hoped. There's a number of variables that go into it. Again, it's not as simple as just making things louder. There's understanding room acoustics. There's understanding the listening situations that you get into. There's understanding digital signal processing. There's understanding how the ear works when there is some hearing loss. There's how the brain interprets sound. We'll get to that a little bit more later. We already touched on it a little bit. We'll get into it even more a little bit later. So there's a number of factors that really go into this. And if things aren't properly configured, you may not get everything out of the hearing aids that you were hoping to get. So it's really important to have a professional that knows what they're doing, is educated, experienced, understands what you're trying to accomplish, not just hear everywhere. There's probably specific situations where you want to make sure you hear one matter more to you than others, and it's important for the provider to take that into account. The device is not being configured properly. Unfortunately, we see that a lot of people coming to our office from other practices first. So that's something to really take a good hard look at. Another one, this might be my least favorite part of audiology, but often the devices aren't properly cleaned. So maybe it was someone who was having some success and now they're not, or it was somebody who hears well sometimes, doesn't hear well other times. Honestly, hearing aids can get clogged with earwax. And if they do, sound can't get out. Most devices have a process for cleaning them. There are filters that can be changed. There are tips that need to be cleaned or changed. Every device is a little bit different. There's some generalities, but every device is a little bit different. And it's really important that you understand how to do that. I saw one research study recently that said that when hearing aid users called their provider to come in and have a problem addressed, somewhere between 30 and 40% of the time, the problem is due to earwax or cerumen, that's the technical name, cerumen, clogging up the hearing aid and not letting sound to get out of the hearing aid and into the ear where it belongs. That's one thing to definitely take a look at. If you're not quite sure the proper way for cleaning, consult with the provider that dispensed the devices to you. Sometimes people forget. Sometimes people need a brush up on how to do it, no pun intended. So if that's something to take into consideration if you're not doing as well as you had hoped. Another is, and this is probably one of the biggest ones that we see, if not the biggest, and it's somewhat related to the first reason, but it's forgetting about or ignoring the role that the brain plays in better hearing or better listening. So, in other words, there are a number of factors that can affect the brain, which in turn affects how well the brain processes speech or music or other sounds that are important to you with the use of your hearing aids. What are these factors? One, we already talked about auditory deprivation. How long has it been since a person has heard properly? That can affect how well their brain processes sound. Also, age. The age of a person can affect how well someone processes sound and speech. We know that if through research studies that if you control for the level of hearing loss, that older people do not process sound as well when it is either rapid or there is competing noise. The older the brain, the more that brain will struggle with those situations. And honestly, depending upon the research studies, you can say that probably peaks in your teens or 20s, maybe 30s. But probably by the 30s, it's declining. Certainly by the 70s or 80s, it has declined. So that affects it. Side effects of medications can affect how well the brain processes sound. A condition called auditory processing disorder can affect how well the brain processes sound. We deal with that a lot in our office, both with folks with hearing loss and normal hearing. People who have had a concussion, people who have had a stroke, brain fog from perimenopause. We're seeing more and more of that. So any number of things can affect how well the brain processes sound. And that is really a large part of hearing. We take it for granted. We don't really realize how much of a role the brain plays in all of this, but it plays a huge role in that. Now, fortunately, if the hearing aids are properly set up and they're properly cleaned and they're properly charged and you've given auditory deprivation several weeks and you've been using them a lot and you're still not doing as well as you would like, then that's when it's really time to consider some exercises or auditory training that we can do with the brain to get the brain processing speech better, both in quiet and in noise, help people remember what they hear better. There are things we can do with an app or things that patients can do with an app in the comfort of their own home. And there are one-on-one exercises that we can do with people, almost like physical therapy. And we can do that either in the office or online as well. There's options for that. I think a lot of people forget that the brain plays a big role in this. And a lot of people don't know we can improve the brain and get the brain processing sound better. If you have some hearing aids or someone you know has hearing aids and they're not doing as well as they would like with these devices, consider these factors. And if all of these things have been addressed in terms of adaptation time and cleaning and proper configuration, it's really time to consider some auditory therapy or some auditory training. We do that a lot in our offices. Again, we're Aberdeen Audiology in the Philadelphia suburbs. If you need some help, we'd love to hear from you. Thanks for watching, and we'll see you next time.